We've got, I think, the challenging task of looking at the science. And I think it's just worth thinking about pandemic infections. And of course, the characteristic of pandemic infections is that they're pretty much all zoonotic infections. That is, they're infections which are acquired by the transfer of organisms from other animal species to humans. And the reason, of course, they're so dangerous is because we have no pre-immunity to them. And as we've heard on several occasions, these organisms are, if you like, completely politically correct. They're able to infect pretty much everyone. The young, the old, the malnourished, the immunocompromised are most at risk. But of course, in the 1918 influenza, it was young and pretty fit people who succumbed to the disease.
We face tremendous challenges in addressing avian influenza from the perspective of the World Bank. The first one is to maintain the political commitment. The second is making available the grant financing. The third one is to address the market failures in making sure that technologies will be available. And finally, we have a tremendous challenge in ensuring that we have sufficiently strong health systems to be able to deliver. We believe that getting the technology right is not the end of the process, it's the beginning of it. And being able to deliver that technology to the people at country level is probably the biggest challenge we are facing today.
So our exam question is, how might new vaccine technology help us to meet the threat of a pandemic? And to kick off, I'm going to ask Triono Soendoro to ask answer a slightly question, which is, do you think new vaccine technology could help us to meet the threat of the pandemic?
Yes, I do.
Good.
To me, we are better prepared now than we were in the past. As an army, you know who is the enemies. But with virus, we don't know who is the enemies. And that's why it's better for us to prepare now. And prepare meaning also for the vaccines.
The question is, when do you pull the trigger and vaccinate? I think what we're talking about now is having a stockpile that you could potentially use when the bell goes off. Everything's fine until the pandemic doesn't come and the vaccines has some unintended consequences. If you had 50 million doses, which is a large amount, and you had an adverse event that was a serious one of 1 in a million, you can imagine the questions that come up when 50 people die and you don't have a pandemic.
Availability of product is not the same as access. And in many ways, this is really the central issue we are now dealing with in terms of influenza, and it is really the central issue we are dealing with in public health. If we think about vaccine in the abstract, it is simply a thing which doesn't exist in containers or anything, can help people. When you actually look at the product from the point of view of getting it to billions of people, you begin asking yourself, are there enough syringes and those sorts of issues? There are not enough syringes right now. And there are those kinds of barriers. And then you have to get it into people. You know, this goes back to what basic public health is. Do you have enough staff out there? Are they adequately trained? Are they educated? And so on.
I understand that most of the time when we talk here, we refer mainly to biomedical or hard science and hard technology. But actually, we have very effective social vaccines and social technology available without patent, without copyright, without intellectual properties, that we can employ anytime, and that we can stockpile into every brain of every people in the country, anytime. And it can be used even before the biomedical vaccines is available. Information sharing implies a lot on the economic situation of the country. It has to do with the transparency policy. It has to do with economic implication. If you are transparent, but the whole world punish you heavily economically, do you want to be transparent?
One of the misunderstandings about sequence sharing is that by disclosing a sequence, you immediately preempt other people's intellectual property over that sequence. And sadly, that's not the case. A very large proportion of not only human but many pathogen genomes are subject to very substantial patent protection or patent applications, which can ultimately preempt the use of the sequence, even though it may be available on the internet for any scientist to inspect and build their careers on, to build products and services is a very different matter altogether that requires confidence in the ability to use for commercial purposes and to secure investment to allow that to happen. So there's a fundamental challenge for the research community to realize it's a tiny part of the innovation chain, and the intellectual property protection over research products can completely stymie progression through that chain.
We are not yet in a situation where we can be comfortable that we have got H5N1 in poultry under control. And so I would just once again request that as we're thinking about solutions that will help us to prevent a severe pandemic occurring, given our concerns about H5N1 as a potential candidate, please, at the same time as thinking about a pre-pandemic vaccine against H5N1, please also consider why it is that we still lack in some countries both the political will, the management systems and the resources to deal with the comparatively simple problem of this infection in poultry.